Hi everybody, Mitch Lepicello here, coming to you today with more ASD parenting topics and tips. And today's topic is a question I often get from parents about, should I talk to my child about their autism spectrum disorder? And it's a very fair question, because generally when we ask that question, we're really not sure what to say, and we don't want to say anything that would harm them or that would cause them any more angst than they're already in. So, like many things, kids do better when they know about what's happening to their body, what's happening to themselves. So, talking to them about a wide variety of topics, their mental health, their emotions, how they come across, is a generally good idea. When children get the diagnosis of autism spectrum disorder, I'm generally in the camp of and feel very positive about helping parents talk to their children about their ASD. Now, let's dig into that just a little bit. All children may not get the same information the same way. For example, somebody with ASD that is, a child that is 5 years old might learn about that information differently, or we might tell them differently than we would a 12-year-old, a 15 or 16-year-old, a 25-year-old, and so on. So we want to be not whether we talk to them about their ASD, but how we talk to them about their ASD. So again, like many things, we want to kind of be age appropriate in our discussions and our communication. So we can say things and use language like, sometimes you get stuck on things. That's okay. That's the way your brain works. Or you get really focused on something. That's your superpower. That's your ASD superpower. So I've heard parents, and these are actually things that parents have said to me, so I'm kind of passing them on to you guys, because I love the way parents who have come into my office or I've talked to on the phone have said, Mitch, I want to share with my child. I think they have a lot of great skills and abilities, but I don't know what to say and how to integrate that with their ASD. And so we've come up with different phrases, and that's one that I've heard is your ASD superpower. I really like that one. So we want to frame things in the positive whenever possible, but it's okay to also talk about challenges. It's okay because everyone has challenges, right? Nobody's without a challenge that they have to work on or try to figure out in their life. So it's okay to say, for example, to a young child, like a 5 to 9-year-old, let's talk about food sensitivity. You're really specific about what you want and what tastes good in your mouth, and we're going to really work on trying to find those things. When we can't, what are we going to do? What's the plan? Your sensory integration or your sensory intrusions are just another part of your ASD. It's not the whole of who you are. It's just another part of who you are. And so we use those kinds of phrases and communications to help kids kind of understand that their ASD is just something that they got to work on, but it's not who they are as a person. So if there are other situations or examples that you're wondering about, contact me through Facebook, or let's talk about this. Feel free to contact me in any way, shape, or form, and we'll go over how to help you talk to your kids about ASD. I hope this video has helped you, and provide any feedback for me when you see it on Facebook or on my page, and feel free to contact me anytime with any more questions. So thanks again, and I hope this topic of how to talk to and whether or not to talk to your children with ASD is a good, and you've learned some good tips from that. Okay, thanks so much.